Pain in the temple and eye socket in the crown, head and base of the neck can result from problems with the Splenius Capitis and Splenius Cervicis muscles. In this video, you will learn how to independently identify the problem with these muscles, as well as how, with the help of simple exercises, you can quickly eliminate this pain at home and prevent it recurrence. I'm Dr. Chernov, enjoy watching. The Splenius Capitis muscle is covered by the upper part of the trapezius muscle. At the top, it attaches to the temporal bone, and at the bottom, it connects to the spinous processes of the lower cervical and the upper four thoracic vertebrae. The Splenius Cervicis muscle is located below. At the top, it attaches to the transverse processes of the upper three cervical vertebrae, and at the bottom, it connects to the spinous processes from the third to the sixth thoracic vertebrae. It lies beneath the upper posterior serratus muscle, then is covered by the rhomboid muscles and the trapezius muscles. The Splenius Capitis muscle is very often a cause of headaches, a tension area or a trigger point. Located in the Splenius Capitis, it usually reflects pain in the crown area. The Splenius Cervicis has two characteristic locations for trigger points. The first trigger point, at the upper end of the muscle, often causes head pain. This pain spreads to occipital area. With both muscles involved, headache feels like a band around the head. The trigger point located in the lower part of the Splenius Cervicis reflects pain upwards and at the base of the neck. It's important to note that trigger points in the upper part of the Splenius Cervicis can also cause numbness in the occipital area instead of pain. Reduce sensitivity and stiffness in the neck. They can also provoke a decrease in visual acuity on the affected side. Normally, when you tilt your head forward, you should be able to touch your chin to your sternum. If there's a problem with the Splenius Capitis and Splenius Cervicis muscles, then when trying to press your chin to your sternum, there remains a gap of several centimeters between them. When there are trigger points in these muscles, there will also be a limitation in active rotation of the head and neck towards the affected side. An even greater limitation in neck rotation will be observed if the muscle that elevates the scapula is also affected by trigger points. You can find a link to a detailed overview of this muscle in the description. Prolonged overload can trigger the activation of trigger points and the onset of characteristic pain. The neck muscles are affected by poor posture and a forward head position. While working at a desk, when the head leans forward and is turned to one side, a posture with excessive neck extension while watching a movie, playing a number of musical instruments, for example the flute or violin, staying in a draft after intense strain on the neck muscles can also increase the likelihood of trigger point activation and the onset of headaches. The Splenius Capitis and Splenius Cervicis muscles are very sensitive to injury. Therefore, various traffic accidents that involve a sudden stop or a rear-end collision, especially if the head was turned to the side at that moment, are very likely to lead to damage to these muscles. Unfortunately, such patients rarely receive adequate treatment for pain that is essentially myofascial pain. Stresses from excessive physical activity, for example, while learning to do a handstand, as well as when lifting heavy weights, can also trigger the activation of trigger points, especially if they are accompanied by turning the head and neck and extending it forward. You can independently relieve trigger points in the Splenius Capitis and Splenius Cervicis muscles, and you can get rid of headaches at home by applying strong mechanical pressure to the area trigger point with subsequent muscle stretching. You can apply pressure with your hands only on the more superficially located Splenius Capitis, inside the triangle bounded in front by the sternocleidomastoid muscle, behind the upper part of the trapezius muscle, and below by the muscle that elevates the scapula. Once you've found the area of increased tension and tenderness, press on it for 30-60 seconds, looking down and slowly exhaling through your nose. After that, check the opposite side of the neck for trigger points. You can apply the necessary mechanical pressure to the deeper located Splenius Cervicis using a single or double massage ball. Take a massage ball, approach the wall, and roll it. The area located to the side of the spine, from the base of the skull to the level of the thoracic vertebrae. Once you've found the areas of tension and tenderness, press on it for 30-60 seconds, then repeat the exercise on the other side. It's even easier to do this on a double massage ball, which massages both paravertebral zones at once. And if you want to apply even more intense mechanical pressure, do this exercise on the floor. The weight of your body will help you reach the deepest layers of the muscles. And if you have a good level of physical fitness, you can do an even more challenging, but very effective exercise with your hips raised and your hands wrapped around your head. Naturally, if you have very painful neck muscles, start with the simplest exercises. After applying massage to the Splenius Capitis and Splenius Cervicis muscles, it's necessary to stretch them. Since these muscles extend the head and neck when they contract bilaterally, and when they contract unilaterally, they turn the head and neck. To stretch them, you can tilt your head and neck forward, and also by rotating your head with a lateral tilt towards the side opposite the affected muscle. Hold the final position for 1 to 3 minutes and be sure to repeat the exercise on the other side. It's best to do stretching exercises for the muscles under a warm shower. In this case, warm water helps to relax the muscles better and stretch them more effectively. After that, do a full flexion of the head and neck very gently, followed by extension and turns to the side, repeating this cycle at least 3 times. For a more intense workout of the neck muscles, and to achieve an even more noticeable result in relieving headaches, I recommend regularly doing a simple set of exercises linked in the description of this video. Take care of your neck muscles from cold exposure and overloads, and also pay attention to maintaining good posture and avoiding a forward head position while walking, driving a car, using a smartphone, or sitting at a computer. When working at a computer, the monitor screen should be at eye level. During sleep, it's very important to choose the right height for your pillow, maintaining a neutral position of the head and neck, which prevents overloading or overstretching the muscles. Also, check out this playlist for videos about pain in the temples and the back of the head, stemming from trigger points in the semispinalis muscle, as well as reviews on other muscles that cause pain in different areas of the body. Stay healthy and see you in the next videos.